Hi, I'm Dr. Kunj, and today we're going to talk about how you can eliminate microplastics from your oral care routine. We're going to talk about some new studies that have come out showing why microplastics are so harmful, and also how easy it is to start removing them from things like your daily routine for oral care. All right, let's get started. So, a study came out last year in March of 2024 showing that microplastics and nanoplastics are found in people's carotid artery plaques. It was a 300-patient study, and they were followed for almost 3 years. And what they found is that if you could find microplastics in the artery walls, then you could predict the rate of having a major cardiac event by 4.5 times. If you look at studies on smoking, current smokers have a hazard ratio of about 2 times by comparison. So this is really significant. There's also another study which showed that you can find microplastics in human testicles. It was found in all of the testicles that were analyzed. It looks like supermodels aren't the only ones with plastic parts anymore. Well, Mr. Smith, good news is you're in vogue. The bad news is your body is trending in all the wrong ways. Another study showed that microplastics and nanoplastics can probably cross the blood-brain barrier based on some mice experiments. So there are some commercially available tests now to measure how much microplastics are in your blood. And experts say that we're currently consuming about a credit card's worth of plastic each week.
This fact has been debunked.
Even Capital One, they're now saying, what's in your stomach rather than what's in your wallet. So what's the point of all of this? Well, it turns out there are some things you can do. The number one thing is you can stop fueling the fire, but specifically with your oral intake. Let's take a look at the oral care. So everything in the oral care routine is made of plastic. The toothbrush, the bristles, the toothpaste container, the floss. We're going to take a look at each of those one by one. Well, the brush is pretty simple. There are now bamboo toothbrushes with castor oil bristles. I recommend a powered toothbrush versus a manual one based on this Cochrane review, which showed a 21% reduction in plaque when assessed after 3 months of use. How about the toothpaste? Unfortunately, there are a lot of toothpaste containers that are now made of glass or metal, but what about the actual toothpaste? Well, I still recommend a fluoride toothpaste over a non-fluoride based on this Cochrane review, which showed that there is high certainty evidence that fluoride toothpaste is more effective than non-fluoride toothpaste. And furthermore, there seems to be very little systemic absorption if you do not swallow the toothpaste. Just rinse your mouth out and spit it out. How about foaming versus non-foaming toothpastes? Obviously, that bubbly feeling makes you feel nice and clean, but it turns out that the non-foaming toothpastes just as well, and they cause less oral ulcers. Painful. So there are many options out there. Not as many as I'd like, but here's one called Unpaste, which is available in Germany. It is fluoride and non-foaming, and furthermore, there are no plastic packaging at all. Here's another one on Amazon, although I should say it does have a lot of other ingredients which have yet to be demonstrated to be effective in clinical studies. How about the water pick to floss your teeth? Well, unfortunately, it doesn't seem that there are any non-plastic water picks out there. How about this guy? What does this guy recommend? Well, he uses Dr. Tongue's, and in the past I've used that as well. It's an expandable floss. When you look at the ingredients, apparently the threads are made of polyester fiber, a plastic. Anything poly is typically a plastic. So instead, try and use this silk expanding floss, which is not made with any plastic and is still expanding. Here's a non-plastic floss that is made of silk. There are other ones that are made of bamboo. This is also an expanding dental floss. By the way, should you floss before brushing or after brushing? Well, it turns out, based on this study, that you can significantly decrease the interdental plaque by flossing before you brush rather than afterwards. You can see a significant difference here. The reason probably is because you can get some toothpaste in those nooks and crannies right after flossing. To summarize, there are a lot of things you can do to minimize your microplastic exposure in your daily oral care routine. And this is so important to pay attention to because collectively, as consumers, if we buy healthier products, then manufacturers will make healthier products. It's the invisible hand that Adam Smith described. All right, hope you like this video. All the references and product links are in the description. Feel free to like and subscribe. Thanks.